Are you struggling with elbow pain when you exercise? In today's video, I'm going to guide you along to find out some of the root causes of your elbow pain and also show you steps that you can take to fix it. Elbow pain is pretty common with exercises like chin-ups and bench presses, as well as sports like golf and tennis. That's why they're called golfer's elbow and tennis elbow. My perspective on injury prevention and rehabilitation is not about looking at the symptom. Oh, it hurts here, it must be golfer's elbow. Oh, it hurts here, it must be tennis elbow. The symptom is just your body saying, hey, something is wrong. But the cause can be multifactorial. You may have elbow pain here, and I may have elbow pain here, but the causes might be completely different. So for your pain and for my pain, the rehab technique or the habit we need to change might be completely different. And that is where the challenge of doing good rehabilitation comes in. There is no step-by-step fixed method for every single person, even though our pain might seem exactly the same. Now let's go through step-by-step a process for helping you solve elbow pain. The first thing you must do is make sure your elbow pain is not a structural problem. This means that nothing is torn, nothing is broken. If something is torn or broken, you should not be watching a video to fix it. You should be getting an MRI and potentially even getting surgery. Here's a simple way that you can perhaps figure out if your elbow pain is structural, something is broken or torn, or it's functional. That means it only hurts when you do stuff. If it only hurts when you do stuff, the things in this video are likely to work for you. If it's structural, you may need to see a medical imaging specialist. The test I call the do nothing test, which means that you're going to not use the muscles around that joint and you're going to move it. For example, if my right elbow has pain, I am going to not use any of the muscles and just use my other hand to move it. So I'm going to put it here and do nothing, and my other hand moves it, completely resting the weight on this hand. I'm going to do different direction. I'm going to rotate it, the elbow, rotate the bones in the forearm. I'm going to push it up and down. And if when this elbow is not gripping, it's not pulling, it's not pushing, it's doing nothing, this hand is doing all the work, and there's no pain, that's a sign that it's probably a functional problem, not a structural problem. If there was a torn ligament or a broken bone, this would hurt already, even if the muscles around that joint are doing nothing. So that's the first step. Check if this is a structural problem. If it is, see a medical imaging specialist. If it's not, let's continue. One of the problems that I see in most rehab methods is that they do it for you while lying down or relaxed. Oh, I'm lying down, I'm getting a massage, or I'm getting an adjustment, or I'm getting a acupuncture treatment. Nothing is wrong with those things, but you're trying those things in a totally relaxed position. That doesn't make sense, because most people are fine when they're lying down. Your elbow is fine when you're doing nothing. It's when you're swinging a tennis racket, it's when you're doing a chin-up that it hurts. So my next tip is that you do all the following rehab suggestions next to the activity that hurts. So if chin-ups are painful for you, do the rehab technique and then immediately try a chin-up. Because it's not structural, it's either muscular, and oftentimes it's something to do with the nervous system. The nervous system responds very quickly to treatment. It may not be permanent because you may have had this problem for a long time, but definitely after you try the rehab technique, the nervous system responds and pain should be duller or lesser. So now you need to quantify your pain on a scale of 1 to 10. 1 would be pretty much nothing. 10 would be someone stabbed you. And maybe 3 is a dull ache. 7 is pretty sharp. You quantify the pain on this scale so that when you try the rehab technique, you'll know if it's getting better. Because the cause of your pain could be very different from someone else's, some techniques might work great for you, while other techniques give you almost no benefit. However, the opposite could be true for someone else with the same elbow pain. Each person will be different, and each of these techniques may give you different levels of benefit. That's one of the problems with trying to do injury prevention or pain reduction online. I can't be there with you and test individual muscles. So you need to take some responsibility and do all these techniques yourself and see which one works for you. Let's go on to the first technique. The first technique is to relax your jaw and eye muscles. Yeah, everyone's asking like, what's my jaw and my eyes got to do with this? Listen, your head position affects your neck position, and your neck position determines whether or not all your nerves can send the correct amount of signal to your upper body muscles. If the nerves cannot control muscles properly, the muscles will probably be too weak. And then when they're too weak, they cannot stabilize the joints. Because muscles don't just move joints. When muscles work together, they stabilize the joint and give it less pain. Also, when a joint is unstable from certain muscles not working well, other muscles might try to compensate and they'll tense up and become really tight and stiff. That will pull the joint in a position it's not meant to be in, also giving you joint pain, also putting stress on your soft tissue like tendons and ligaments. So, when you align your head, joints get better. One of the things that puts your head out of alignment is eyes that don't move perfectly together, or jaw is too tight or unbalanced because maybe you've pulled out teeth before, or you had jaw problems before, or joint of the jaw problems before. And this has muscles that connect to your shoulder blades. And from there, your shoulders and upper body can be out of balance. So, after you've done your chin up, or whatever activity hurts, and okay, you have an elbow pain of let's say 7, you're going to try these 2 techniques and then see if the elbow pain goes down. For the jaw, very important, don't clench it, don't clench it. To prevent clenching, keep your tongue at the roof of your mouth. This counterbalances the chewing muscles with the tongue, which pushes up, chewing muscles push down, and they balance out, your jaw doesn't clench anymore. That allows your head to be more balanced. Then, you can relax the jaw by gently stroking the skin here. This gives the nervous system a signal to relax the jaw. So do this for 15 seconds. Side view, just here. 15 seconds of that, and then eyes. For eyes, make your thumbs together like this, so there's a line between your thumbs. From here, put the thumbs at the level of your eyes, and keep your eyes focused on that center line between your 2 thumbs. Slowly turn your head one side, while keeping your eyes both locked on the line between the thumbs. And then slowly, about 5 seconds, slow movement, do the other way. Eyes again, focusing on the center of the thumbs. Eyes, eyes. Okay? So your eyes, especially the eye that's further away, has to turn in more and look at that line between the thumbs. This turning movement helps warm up and stretch the muscles that control the eyeball. When the eyes move in parallel, head is also more aligned, because the brain is actually using the eyes to see what's outside there, and if the outside vision is not aligned, the brain will think, hey, I better tilt or turn my head to change that alignment. Eyes balanced, jaw balanced, head balanced. Once you've done the eye exercise, maybe 10 reps, both sides, okay? So it's about a minute, and then the jaw relaxation for another 20 seconds. Try your painful movement and see if the pain has gone down. For many people, this increased balance of the head allows better nerve flow, allows better muscle function, reduces the pain. The second thing to try to help reduce elbow pain is to activate and relax the muscles around the elbow so that they return to their normal length. Sometimes, if a muscle is trying very hard to stabilize a joint for whatever reason, it can be too tight, or if for a long time the nerves weren't going properly, maybe it's too weak. So we're going to activate and relax the main muscles around the elbow joint. When you do this technique, you're going to alternately activate and relax the muscle. This will help to return the muscle back to its normal function. That means normal length and normal strength. For most people, the pain happens to be either on the outside bone here, also known as tennis elbow, or on the inside bony part here, also known as golfer's elbow. These 2 points are attachments for tendons of different muscles. The muscles that attach here generally do wrist flexion, which is bending your wrist down, as well as wrist extension, which is this. They also do supination, which is to roll your wrist open, and pronation, which is to do this. The names of the movement, don't worry too much. You just need to know that it does all these things, and now we're going to use those movements to alternately contract and relax those muscles. The first movement is flexion and extension. So let's say my inside of elbow hurts. Inside of elbow connects to most of the muscles that flex the wrist. So it's going to be more likely to be painful if I flex the wrist. But now, in the position where there's maybe some discomfort, I'm going to do alternate relaxations and contractions. Watch this. Now, this is inside elbow. So from here, I'm going to push and I'm going to resist myself. I'm pushing this way and I resist for about 5 seconds. You don't need to push with full strength. Maybe like 30% effort, okay? For about 5 seconds. 1, 2, 3, 4, 5. Pushing this way. Now I'm going to do the opposite. Instead of pushing this way, I'm going to pull this way. Now I'm going to resist that. I don't let it flop in, right? Resist for 5 seconds. And now, again, opposite. I'm going to push now and don't let myself open up, okay? I push. And for me personally, this one is a bit sore on the inside of the elbow. Probably because I did 2,100 chin-ups over the last 2 weeks as part of my training routine. I have a video about that if you want to find out more about that training method. It will definitely improve your chin-ups. But elbow will be under some stress. So I'm going to push, 5 seconds. And then opposite, 5 seconds. Push and opposite. Alternate that about 3 to 5 times. Next, you're going to do it on the other side because it's slightly different for the muscles when you push on your little finger side versus your thumb side. So now I'm going to push on the thumb side. And then pull on the thumb side. And then push. Pushing out and resisting and then pull. Okay? Again, 3 to 5 times. Different people have different levels of pain at different levels of arm extension. Some people, for chin-ups for example, most people have discomfort when it's almost fully closed. But some people maybe at 90 degrees. For you, maybe it's when it's close to straight. If that is your painful angle, do the pushing and pulling at that more uncomfortable angle. But of course, you can do all angles, 3 to 5 at this angle, 3 to 5 here, and 3 to 5 here. And then both sides, the thumb side and also the little finger side. That is the activation and relaxation for wrist flexion and extension. But the muscles that surround the elbow also do this. Okay? This is pronation, turning in, and supination, turning out. There's oftentimes imbalances in these because of daily posture. We are hunched and we are usually overly turned in for many people. So maybe the inside one is tight. Maybe the outside one, because inside is too tight, outside becomes too long and too loose. So we're just going to activate both sides to balance them out. Okay, it's pretty simple. If I'm going to do this elbow, I'm going to turn in, but the other hand grabs me, so I can't. I'm resisting, 5 seconds, and now I'm going to try and turn out. But again, the hand grabs me, so I can't. I'm going to turn out, 5 seconds. In 5 seconds, out 5 seconds. In, out. Try different angles. In, out. In, out. Maybe straighter. In, out. In, out. Also, you want to try at different angles of this rotation. So maybe you try near flat. In, out. In, out. Also, you try when it's nearly closed. In, out. In, out. You'll find that there's different levels of tension or discomfort if you have elbow pain, depending on the arm extension and whether you're doing it fully closed or fully open. That's just because there's many levels of muscles and small muscles in the forearm that are controlling also the elbow. So you'll find that, hey, everybody's pain comes from a slightly different angle or position. Your brain controls muscles differently at different angles, so it's very common, very normal for different people to experience different levels of discomfort or activation at different extensions and different angles. So after you've done about 5 reps, holding 5 seconds, hold 5 seconds with about 30 to 40% effort, and you do it at different angles and different arm extensions, go and try your painful movement again. For many people, I found that this one actually helps them a lot. Okay? Because turning on and relaxing muscles to bring them back to normal should give the joint much better stability. Of course, the joint may still be inflamed or may still have some other problems because it was out of position or not stable for many weeks or some people many months or years. So there might still be some problems there. But when the muscles are working well, most people will find that the pain becomes duller. It's not as sharp. Maybe it was a 7 or 8 very sharp. Now it's a 4 or 5 duller. This just means that this method is working for you and you need to do it often. Probably a few times a day. Maybe for you, the eyes and jaw and the activation hasn't helped you that much. So the next thing you want to try is you want to ask yourself, if my joint and muscles are so spasming and tight and causing me joint pain, could it be that there's other things in the forearm and elbow that are unstable and the muscles are spasming to try to keep that part stable? So you can try this. You're going to compress the wrist all the way up the forearm like this. This will actually reduce any tension on the structures that hold your wrist stable and hold the two bones in your forearm stable. There are connective tissues that if they're strained, the body will say, hey, this part is under strain. The two forearm bones are slightly out of position or they're under tension that shouldn't be there. Then the muscles around the elbow and wrist will tighten up to try and hold that place more stable. So try compression of your wrist like this and forearm. It should, temporarily at least, unload tension in those structures. Then try your chin up or whatever movement. If this helps, it means that when you train, at least temporarily, you should wear a wrist compression or you should wear a forearm compression. This will help reduce the pain because the body says, hey, now these are more stable, I don't need to spasm the muscle so much and pull that elbow joint either here or here out of position. The next area to compress would be the elbow joint itself. There are ligaments around the elbow, so you're going to compress the entire elbow joint. Okay? Once again, after you do that, try your painful movement. Always trying to see what fixes the pain in the painful movement or position, not lying on the bed. If the elbow compression works or near the bony areas, these areas the compression is helpful, you can consider wearing an elbow guard or one of those golfer's elbow compression straps when you train. Right? This will help the pain when you're training. And it will also help you during daily life. If you are having this problem, you need to wear that guard not just when you're training. You need to reset the brain's thinking that, hey, I'm keeping this stable, no need to have inflammation, no need to have so much tension in these elbow common pain areas. Okay, so you've done head alignment, you've done activation of the muscles, you've done compression of the joint. The next thing you can try is you can try simple nerve flossing. This helps the nerves that go through this area to move more smoothly and control muscles better. In the arm, there are 3 main nerves, and we're going to try to move the nerve so that it moves more smoothly in the body and hopefully gives you better signaling, better muscle function. So I'm going to show you the different nerve mobilization for these 3 nerves. The first one's called the median nerve. This is probably the most common problem source, okay, for the elbow pain. So you do like this. You're going to bend your wrist back, elbow up and out at 90 degrees, 90 degrees. As you straighten your arm with your wrist down, you're also going to tilt your head. As your arm comes back, you bring your head back. So it looks like this. Tilt head, eyes looking forward, extend your arm out, and come back. Out, and back. Out, and back. You do about 10 reps of this. This is mobilization for the median nerve. The next nerve you can try to mobilize is called the ulnar nerve. Movement is very similar to the previous one, but the hand is now this way instead of this way. So here, and the hand moves to point the wrist down, and the head also moves in the same direction at the same time. Okay? So you go here, down, and back. Down, and back. Fully stretch out. Neck and elbow and arm fully stretch out and come back. Okay, that you could try 10 reps. And then of course, try your painful movement. Is it better? The third nerve we're going to work on is called the radial nerve. For that, arm totally straight, And the wrist is what goes backwards and straight. Backwards and straight. Okay? So, as the wrist goes back, my head also tilts this way. So it looks like this. Here and back. Here and head can even go a bit the other side. Here, back. Wrist goes back, head goes this way. Come back, final one. Wrist goes back. Head comes this way. Arm totally straight. Okay? So you can do 10 of this and see if that helps your painful movement. Another potential thing that may be causing your elbow to have strain or stress or pain is lack of flexibility in other parts of your body. So when you do your sports movement or when you do your exercise, the elbow is forced to take on more stretch or strain than it should. The most common area of lack of flexibility is in the shoulder. And that's because, again, we're too hunched and slouched most of the time, so the shoulder is stuck and can't move properly. Then when you try to exercise, the elbow has to do more stretching, which is beyond its normal requirement and normal ability. Let's take, for example, the most common type of chin-up that causes elbow pain. Palms towards you, or supinated grip, close grip chin-up. Alright? When you do this, if the shoulder is not able to rotate open, the elbow has to twist more for this exercise, the wrist has to twist more, and then you get elbow and wrist pain. So now we're going to check this shoulder flexibility. This is especially common in people that like to do a lot of upper body, like bench press, push-ups and all that, but don't work their upper body muscles in balance. So they don't do external rotation. They don't do shoulder blade exercises. Okay? So when I design training programs, one of the things to consider is the amount of training for pushing, pulling, rotating all balanced? That will help reduce long-term injury risk. So the test looks like this. You put one hand out, palm up. Almost everyone will be able to do this. The trick is to keep the palm facing up as you raise your arm upwards. Totally straight, okay? Don't cheat. Totally straight. Up, 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 up. Is your palm still facing up? Yes, that's good. Most people cannot get to fully vertical and palm facing up. You see, even myself, I feel like turning my hand inwards. But you should be able to get about 50 or 60 degrees with palm up. So I'm palm up, here I'm still palm up. Now, very important, you don't use your shoulder and stuff to like do all these kind of things. Body totally stationary, palm up, slowly lift it up and see, okay, from here I can feel it start to turn in. But that's about, 65, 70 degrees. So my shoulder flexibility is likely not the cause of the elbow discomfort. If you try this test and at 20, 30 degrees it already feels like turning in, high chance it's your shoulder's lack of mobility or flexibility that's forcing your elbow to take more strain and cause elbow pain. That means you should be doing more small muscle of your shoulder kind of exercises, as well as scapular position exercises, as well as stretching and mobility for your shoulder. This is very likely to improve your elbow pain because lack of shoulder mobility is likely one of the causes for you. So if you find your shoulders are lacking mobility, that may be causing your elbow pain after doing the test, a simple thing you can do is get a band and you attach it to something and then you grab it and just move your shoulder around and pull it and stretch it, just moving the shoulder in different angles, okay? The reason is that this turns on all the small muscles that you use to stabilize the shoulder, and after that you find that, hey, the shoulder test gets better, okay? It's even more effective than just doing stretches. So if you don't have a band, you can grab something and pull, gently pull as you move your shoulder around. But a band gives all kinds of different angles, like back, forward, up a bit, down a bit, rotate and pull, this way and pull. There's no real right or wrong. It's just that you want all the small muscles to turn on. This usually allows both forward and backward and round movement, okay? And when you do that, you try your shoulder test again. Many people find that it's easier to do the test because now all the muscles are turned on and the shoulder's more stable, and the brain says, okay, now you're stable, I'll allow you to be more flexible. The last tip I have is good old-fashioned massage. But I'm going to suggest a few tips to you to make the massage more effective. The main tip is very simple. you're going to move the joint while you are massaging. There's no special movement. You just want to move while the pressure is on. It gives more signaling to the brain, which tends to reduce the tension and reduce the pain faster. When you have elbow pain, the main areas to massage are, you feel the bony part where the pain is? Usually you want it to be a bit more towards your wrist. So you feel for tender spots around this area. Okay? Just gently press, don't press too hard. When you find a tender spot, let's say here, you're going to hold it with pressure, and while you hold it, you move the wrist and also move the arm. Okay? The next area would be in this area here. Your biceps, elbow, and this area here has two muscles called the pronator teres, which is here, and the supinator, which is here, that often get tight and uncomfortable. So feel, move your wrist, do this, and feel for where those muscles are. There should be one here and one over here. Okay? If you can't feel them because you're new to this, don't worry. Just gently press for any tender spots. And oh, maybe there's one here. And while you're holding on the tender spot, bend, straighten your arm, turn your wrist as you do this. Okay? When you hold, you press down and stretch a little bit and move your arm around. Okay? Do this for about 15 seconds. Then find the next tender spot. Maybe there's one more outside here. Okay. Then you do this for 15 seconds. So remember, check the inside, check the flat part, and then check the outside. Again, outside bony part, and slightly towards the wrist. Usually there's some tender stuff here. Okay? Slowly search for tender spots. Again, don't press too hard. Just press slightly harder than normal, and you should be able to find if there's a problem, there'll be a tight spot there. Now, you press down on it, you stretch it a little bit, and start moving the joint for 15 seconds. There's one final location that many people don't even think about. That is the opposite side elbow in exactly the same location where you have pain. So let's say, for example, I have pain on the outside, right? Tennis elbow. This location is the site where I perceive the pain. But it's possible that the cause is on the other side, exact same location as the pain. The reason is this thing called gait. In gait or walking, we walk opposite arms, right? And sometimes the opposite side, same place, can cause problems for this side. So you massage on the opposite side, exact same spot, because sometimes this area will cause this pain. And when you press it, surprisingly, it can be extremely tender. That means that it doesn't feel pain, but when you press it, it's extremely tender. That's when you know it's possibly a cause for the other side pain. So that's the final area to do some self-massage on. Same thing, press, stretch, and do light movement on the opposite side. Do this for all the tender spots, and once again, try a painful movement. Does it feel better? For many people, this will also help. Try each of these methods and comment below. Did they help your elbow pain? Now that you see all the different solutions for all the different causes of elbow pain, while you are having some elbow discomfort, you should still train, but not training into the pain to make the problem worse. So some suggestions for training is that you should train similar movements, but maybe with an angle or grip that does not hurt. This would allow the other muscles to stay strong, not get weak and small while you do nothing while your elbow hurts. Okay? So for some people, changing the grip to neutral grip feels better. For some people, changing the grip to palms away or pronated grip feels better. So you could practice maybe a short-range golf game, right? Where you don't have to put so much force into the club. Or you do different tennis strokes. So your elbow can recover, but your sports performance or your strength doesn't drop too much. If you're doing exercise in a gym, another few suggestions for bench press would be to use a thick grip. Thick grip bars or a fat grip actually feel better for most people's elbows. For chin-ups, you could change the grip from this one to this one or this one, and different widths. See which one makes you feel less uncomfortable. And finally, you could use an implement like a gymnastic ring or some of the chin-up bar attachments that can move. So that even if your shoulder flexibility is a problem, your elbows are free to move. They're not stuck and locked in by the bar, which puts a lot of strain on them. Here are some of the grips I have on my chin-up bar that if I have any elbow discomfort, I'll use more because they are flexible. They are moving and they allow your elbow to take less stress when you're doing chin-ups. Now that you have all these different methods, you understand that all of them are safe. But which ones of them are working for you, those are the ones that you'll spend more time on. That's why you needed to rate the pain, right? So you try the eyes and the jaw. Got better. That means that you should be doing that every day about 4 to 5 times. Oh, the massage helps. Well, then you should be massaging every 3 to 4 hours for about 20 seconds on each tender spot. Oh, the activation helps, okay? Against resistance. Well, then you should be doing that every 2 to 3 hours for 5 reps, especially in the positions that are most uncomfortable for you. The whole idea of this is not to become tired. The idea is that you're trying to train your brain to turn back on the muscles and bring them back to their normal length and normal strength. You're trying to train your brain to relax the tender spot that you're massaging. You're trying to train your brain to align your head properly. You can do these many times a day because they're not hard to recover from. It's like learning a new language or a new skill for your brain. It's best trained multiple times a day, but when you're fresh. You don't need to be sore or tired when you do that. So in the end, make a list of the things that help and put it into your calendar or schedule so you can do them consistently and get good results. I hope you've learned something about the thought process of injury prevention and pain management. It's got to be broad-based and holistic because the causes can be from multiple places. And you'll find that if you go to a good therapist, they'll do even more tests to find out even more potential causes. Hope you found this video useful. For more content that can help you solve your fitness and health problems, please subscribe to my channel.